Good afternoon, everyone, and welcome to the American Pakistan Foundation's annual Fellows presentation. My name is Maha. I am the APF Executive Administrator, and along with APF Director of Operations, Henry Alfman, we are thrilled to be your hosts for today's exciting event. At APF, we take great pride in providing all our fellows and interns with an experiential learning and environment that prepares them to excel in a global context. Through our programs, our fellows have gained invaluable skills such as critical thinking, research and analysis, career development, and an opportunity to engage with mentors and professionals across various sectors. It's all about building your futures while giving back to the next generation, and today is about celebrating your dedication and hard work. We're honored to have with us today our fellows, interns, and partner organizations, all of whom are key figures in driving the APF mission forward. Our esteemed partners include the Stimson Center, Sehat Kahani, and Polygon Education. Let's get started to celebrate the incredible work of our 2024 APF fellows and interns. I would like to invite Dr. Nasser Qureshi, Chairman of the Board of Directors at APF, to share some remarks. Over to you, Dr. Qureshi.
Thank you, Maha. Welcome, everyone. And it's the final presentation for amazing fellowship program that we had this year. I think we've had them for many years, but this year we've had an amazing group of fellows and institutions that have supported the fellowship programs. It's wonderful. I'm definitely our new partners, Stimson Institute and Polygon. Grateful for them. We initiated fellowships there. I must mention Sahar Khan, who took one of our fellows at the last minute because the fellowship program she was supposed to start had to be canceled because of last minute changes at the program. So Sahar, thank you very much. Polygon is a new partner, which is great. And of course, our long-standing partner, Sehat Kahani, and they have been amazing in the fellowship program. I think Dr. Khurram is here, and I would like to personally reiterate our gratitude to her. So I've been following some of the work that our fellows have done, and I am very excited to listen to everyone. I would like to thank, of course, Henry and Maha for the time and effort that they put into the program for its success. Thank you very much. Maha, it's all yours.
Thank you very much, Dr. Qureshi, for your remarks. I would now like to invite Dr. Sarah Saeed Khurram for her remarks for the I would first like to invite Dr. Seher Khan, Deputy Director of the South Asia Program at Stimson Center, to share her thoughts about the fellowship and partnership with Stimson Center.
Thank you so much, Maha, and everyone. It's really nice to meet you virtually. As Maha said, I'm Sahar Khan, and I'm the Deputy Director and Senior Fellow at Stimson Center's South Asia Program. I've had the pleasure of working with Iman, and as Dr. Qureshi said, it was a bit last minute, but we were more than happy to host Iman. Iman is extremely impressive, and we're looking forward to this partnership that we've developed. Of course, Iman was our first summer fellow, and I say summer loosely because Iman had asked if she could extend her fellowship, and we were more than happy to have her extend for over a month. And so she was supposed to be with us for 8 weeks, and now it's 12 weeks. And we are, I think tomorrow is actually, Iman, your last official day. So we're sad to see her go at Stimson. But we're looking forward to this developing partnership, and we hope to host a summer fellow every summer, basically. And so I look forward to working with Dr. Qureshi and Henry Alpin on that. But I'll switch it over to Iman so she can explain some of the work that she's done for us over her time here. And I just wanted to say, Iman, thank you so much. You've been such a positive force in our team. And while we are saying bye to you tomorrow, it is certainly not bye forever. So we will remain in touch. But over to you.
Thank you so much.
Thank you so much, Dr. Sahar, for sharing your experience of partnering with APF. And now we'll hear from the Stimson Center Fellow herself, Iman Camille Umar. Iman, the floor is all yours.
Hi, everyone. My name's Iman Umar, and I had the good fortune of serving as the American Pakistan Foundation Fellow at the Stimson Center South Asia program. Yes, so before I begin my presentation, I do want to talk a bit more about how I'm going to structure it. So I do want to talk a bit more about the new partnership, the projects that I undertook, and life at the Stimson Center. Next slide, please. Okay, next slide. Right, so as the first fellow of at the Stimson Center South Asia program, I sort of had the opportunity to sort of understand the socio-political landscape in Pakistan and it really helped me identify the traditional and non-traditional security issues in the region, which I never really thought I would be able to sink my teeth into. So this was a really interesting and good opportunity. I was able to understand the effects of nuclear escalation, which is a traditional security issue, versus non-traditional security issues such as climate change and how that's affecting the lives of people. And as a part of my fellowship, I was supposed to do one project, but the Stimson Center team was so encouraging, and I really was able to showcase my skill set. So I did 2 or 3 projects that really helped me understand the problems in South Asia and how research influences policy making in the heart of Washington, D.C. Next slide, please. Yeah, so one of the projects was a written product, which was a requirement of the fellowship. And I specifically wrote about something that hit close to home, which is the smog crisis, and that was sort of the linchpin to my piece. But the more research I did, I understood that it was fossil fuel burning, which exacerbated the smog crisis in Pakistan, and I understood it as something that that is a requirement for industrializing nations. So about 59% of Pakistan's total energy supply comes from fossil fuels. And fossil fuel burning increases greenhouse gases and releases harmful chemicals and gases into the environment, which causes the smog crisis. So Pakistan needs to sort of in order to reduce it and in order to uphold the promises that it made to the Paris Agreement in 2015 and in 2021, it needs to lower these. And the only steps that it can take to do this is to invest in renewable energy sources such as solar, wind, and nuclear energy. And the only way this can be done is if the government of Pakistan sort of incentivizes it and encourages independent power producers to invest in renewable energy sources. Multilateral pressure is there. So the upcoming COP might be an opportunity for Pakistan to advocate for itself and phase out fossil fuels. So, the air becomes healthier and Pakistan becomes a more livable country. Next slide. Right, so I also had the good fortune of showcasing my journalistic skills and using them in other departments within the South Asia program. So there's the Strategic Learning Initiative, which creates and produces free online courses on security issues within the Southern Asian region. So that includes, nuclear deterrence and nuclear deterrence and nuclear escalation in the maritime domain. So I helped out with various video editing projects and I'm helping put together a trailer for 7 years of the Strategic Learning Initiative. So that's, I had the opportunity to interview a bunch of experts and, really understand, how dangerous or how harmful a nuclear escalation can be. Right, so I wanted to talk a bit more about life at Stimson Center. So they're a very close-knit community and a really wonderful group who, it's a hybrid sort of setup. So we meet Mondays and Thursdays, we're in office, otherwise we're working 5 days a week. 2 days we work from the office, and on Thursdays, we get together for lunch every Thursday at noon, and we discuss different issues, domestic or international, that are affecting the South Asian region. And, that's a very interesting exercise, and we get to learn a lot about what people are reading and what they find interesting, and so on and so forth. Next slide, please. Yeah, so this is a picture of the whole team. We got together for happy hour. So, some of them have left and some of them are still here. Most of them have left, actually. So, yeah, this is all of us. And I would like to end this presentation by first thanking Dr. Sahar Khan, who is such a leading light and a mentor, and she held my hand through this all. And Dr. Nasser Qureshi, of course, for having me, and Henry for sort of coordinating everything and being such a good support through it all. Thank you, everyone.
Thank you so much for such an insightful presentation, Iman. We loved hearing about your policy analysis and all the work that you did with the Stimson Center. And thank you again, Dr. Sahar. Up next, we have our Sehat Kahani Fellows, but first, I'd like to invite Dr. Sara Said Khurram, co-founder and CEO of Sehat Kahani, to share her experience regarding the fellowship with us. The floor is yours, Dr. Sara.
Thank you. Thank you very much. And good evening and good morning to all of you, wherever you are. My name is Dr. Sara Said Khurram. I'm the CEO and co-founder of Sehat Kahani, a digital health enterprise that's connecting women doctors across the country to patients using a chat audio video enabled platform, all the way from low-income beneficiaries through e-clinics to urban users in the form of an app, which is used by corporates and consumers today. Sehat Kahani has impacted 3.5 million people to date through 7,500 doctors. I think this is our fourth continuous year of the fellowship. And I think every year I'm just amazed at the quality of the fellows that have come our way. This year we had 4, and each one of them carried such an amazing spirit to contribute to the work that they were doing. And I think each of them put amazing effort over 2 months to run a whole research, which is generally not that easy to do in a 2-month period, almost virtually, when there is a 12-hour time difference. But everyone from Rahim to Mifra to Abdi to Neha, I think they gave in their best. And every year when we have fellows, we also attach buddies, supervisors with these fellows to work with them on their research projects. So this year we had our lead research, Mehek, and our research manager, Muzammil, working with them that helped them in data collection, analysis, and discussion, etc. We also had buddies from different departments who helped them put together their research, many of them who joined today. But all in all, I think I'm very, very excited to see their presentations. They've done some amazing work, around Afghan refugees, around economic and entrepreneurial development of health workers that work with us, and also on how economic it is for people in the urban cities to use the app. So as you'll hear the presentation, I think their methodology, their research, their data analysis, their discussions, and the whole research that they've done will come out to you. I'm so excited to hear their presentations. Thank you for sending us such amazing people our way that are helpful to us in our work as well, and given their 100% best. I hope that this partnership continues year after year, and we're able to get more and more APF fellows to Sehat Kahani, working with us, doing important research and working in other departments as well. Thank you to Dr. Nasser, Henry, and everyone else who was a part of this fellowship and made sure that we as Sehat Kahani can provide the best to the fellows who've come to us as well. So I really appreciate everyone's effort and looking forward to their presentations.
Thank you so much, Dr. Sara. This has been an amazing partnership with APF and Sehed Kahani. And as you said, we would love to hear from the Sehed Kahani fellows themselves. So now I would like to welcome Rahim Hirani, Mifra Hayat, Mohammad Abidi, and Neha Farhan to the floor.
Hello, everybody. My name is Rahim Hirani. I'm an MD PhD student at New York Medical College. Before I start the presentation, I just wanted to say that it's been a privilege to be a part of this program and the great support that we have received from both APF and Sehed Kahani. So going forward to this presentation, there are a lot of slides that I have because we had some interesting results that I wanted to show you, but I will just pinpoint the most important ones. And I will be running quite fast given the time we have. So the project that we undertook was a cross-sectional study, a survey-based study themed utilization and barriers of sexual and reproductive health services among Afghan refugees in Pakistan. Next slide, please. So just to give a brief overview, as we know that refugees, particularly those affected by conflict, are among the most vulnerable population and they have unique health needs. And particularly speaking, sexual and reproductive health services, in such contexts, they are often neglected. And on top of that, the collapse of health systems, the exposure to violence during displacement compounds the health risk of these populations. Next slide. So what does SRH services encompass is a wide range of care, including maternal and newborn health, family planning, contraception, treatment for sexually transmitted infections in response to gender-based violence. So for Afghan refugees in Pakistan, especially women and girls, access to these services is essential for their overall well-being and also for significant, but the significant barriers remain. So we wanted to quite explore the access and utilization regarding those barriers. Just a historical overview, since the Soviet-Afghan War, Pakistan has hosted millions of Afghan refugees, and it is currently home to 1.4 million registered refugees, maybe more, which are not taken into account. And most of these people live in places where access is not pretty good. And on top of that, there are cultural and linguistic barriers that compound and complicate the access for these refugees. Next slide, please. So just to give an overview of the stark numbers and comparisons, so only 20% of Afghan refugee women in Pakistan have access to skilled birth attendants during delivery. Around 30 to 50% of married Afghan refugees women use contraception compared to 60 to 70% of general population in Pakistan. And also 30 to 50% of the Afghan refugee women have experienced some form of gender-based violence. So having said that, our research was aimed to assess the barriers to accessing SHR services and evaluate the current utilization of these services. And ultimately, we hope to highlight the urgent need for comprehensive and culturally sensitive approaches that will improve access and health outcomes for Afghan refugees in Pakistan. Next slide, please. So our study design was a cross-sectional, as I said, it was a survey-based study with Sehed Kahani team. We distributed the survey using Qualtrics. And we received a total of 464 responses from the clinics all over in Pakistan. We used data analysis tools like descriptive statistics, logistic regression, chi-square test, and the outcome measures included demographics and factors, variables, including awareness and utilization and satisfaction. So this is our first table surrounding the demographics. As we can see, there are a lot of variables here with age, gender, marital status, education level, employment status, income level. All of them were significantly different within the groups, but we could just highlight that most of our patient for our survey sample was based on 30 to 34 year of age, 31%. And of course, 98% of our respondents were female, 88% were married, and then 65% our sample population had no formal education, 80% were unemployed, and 43% made less than 10,000 PKR. And these are some of the more variables that we included in the study, such as household size, length of stay in Pakistan from the time of their migration, and primary reason for migration. So as we can see here, that 40% or almost half of our sample population moved because of conflict or war in the region. This table encompasses the awareness of SRH services. So how many people have heard about sexual and reproductive health services? So 76% people have heard about those services. Out of those 76%, we can see that most of the people have heard from healthcare workers about these services. And regarding the awareness, contraceptives, pregnancy testing, and antenatal care are among the most highest contributing variables in terms of awareness. And we also asked that how many people have actually used these services in the past 12 months. And out of those people, 464, 284 people have used SRS services in the past 12 months. And why and which services have they used? Most of them were contraceptives and pregnancy testing. And how many times have they accessed SRS services in the past 12 months? Most of them have. So we can see 38% was once and 32% was 2 to 3 times. And where did they access these services? There are many variables that we picked out, but because most of these, our sample population was collected from Sayed Khani clinic, so most 80% of them were from there. So it's a continuation of the same measures. So we also asked them if they had any difficulty in understanding information while accessing these services. So 35% people said yes. Regarding the barriers they face in accessing these services, most of them said inconvenient hours and long distance were the major contributing factors. And interestingly, 92% people said they are very comfortable in discussing SRH with providers. But being a scientist, I'm a little skeptic on that point. But it is a promising point. Frequency of SRH services unavailability. Some people said that there is unavailability whenever they need it. And when asked what would help better access to SRH services, most of the people said extended service hours and reduced service costs. So I will run through these slides, the graphs, which are just chi-square distribution in terms of demographic variables. But on the left-hand side, you will see graphs on the SRH awareness. On the right-hand side, you will see SRH utilization, that they actually used it in the past 12 months as compared to just being aware of. So first is the age. So they were both significantly associated with awareness and utilization. Next, please. Gender was not, the awareness were not significantly associated, but the utilization was. For marital status, both awareness and utilization was significantly associated. Education distribution, the utilization was significantly associated with education, but not the awareness. And employment status, both utilization and awareness were also significantly associated. And income distribution, as we can see, there is some similarity in both graphs. It was significantly associated. Household size distribution, according to 1 to 2, 3 to 4, 3 to 5 to 6, they were also significantly associated. And length of stay distribution versus SRH utilization was significantly associated, but not the awareness. This is a correlation heat map, which is basically just another way of representation or visualization of correlation between awareness of SRH services with our demographic factors. So if you see a really red box, it means that they are significantly associated. And if you see a blue one, it means that they are not very well correlated or associated. So for example, marital status and age are associated here, but the blue box, education level and gender were not. So this is another way of looking at our variables in the study. So we also built a predictive model using logistic regression models to basically see that what factors are good predictors of SRH awareness and SRH utilization using our variables. So on the left-hand side, you can see on the top is the table for awareness. If they've heard about it, it's a predictive model. And the bottom is if the feature important for utilization of SRH services. So predictive model predicted that gender and length of stay in Pakistan were among the top two features for awareness of SRH. And education level, marital status, and employment status were among the top three for utilization. And on the right-hand side is just a confusion matrices to basically show the performance of this predictive model. Next slide, please. So all in all, wanted to summarize the study project. 76% of respondents have heard about SRH services, and 65% of people are also aware of the mental health services that comes along with SRH services. And are approximately 61% of our sample population have used the services in the past 12 months. And among that 61%, most of the people use contraceptives and pregnancy testing services. For regarding barriers, 35% reported difficulty in understanding information. So that's an area where we can really use some work. Also, 35% people cited inconvenient hours as a major barrier. And long distance for 28% of the people, and 62% of people mentioned cultural beliefs as an influencing factor. And also regarding satisfaction metrics, 83% of the people felt supported by their community in accessing these services. And 85% of the people are satisfied with the services they received. And 85% also noted the services positively impacted their overall well-being, contributing, the significance of these services. I would really like to thank the team from both Sehat Kahani and APF for this wonderful opportunity and the support that they have provided throughout this fellowship. I had a wonderful time, and thank you so much.
Thank you so much, Raheem. Up next, we have Mifra Hayat.
Assalamu alaikum and hello everyone. I am Mifra Hayat and I am a graduate student at Harvard Medical School studying bioethics, and this is my second master's. I'm really excited and grateful to Sehat Khani and the American Pakistani Foundation for giving me this opportunity, and I'm really excited to show my research to all of you. Next slide, please. So my background is in biology and bioethics, but I was really interested in this project because it kind of combined my interest in AI with research in Pakistan. So in this project, we're focusing on telemedicine, how it can help patients and physicians alike, and really bridge the gap between them in understanding and delivering these therapies and medicines. And it also kind of takes Sehat Kahani's clinical approach and analyzes how it has helped Pakistan throughout the years. And next slide. So we really have to go into Pakistan's history and see what the actual issue is. So Pakistan itself is facing a major health crisis where it has an issue with the doctor to patient ratio. So the World Health Organization really focuses on this issue and says that the recommended ratio is 1 to 1,000. But in Pakistan, it's 1 to 1,300. So we already have an issue with lack of medical professionals. That being said, the majority of people who need help are in the rural areas, about 65%. And the issue is that most physicians do not really want to work in these areas. There is a matter of culture as well, that many men feel that they want their women to see a female doctor to protect their izzat or their respect. And they don't want their, say, wife, daughter, cousin, sister, whatever it may be, to see anyone that isn't a female. Also, female doctors have a disadvantage in Pakistan because even though they're insanely gifted and talented physicians, they're, for cultural reasons, whether it's marriage or children, do not end up practicing. So what can we do to really bridge this gap? And thanks to Sehat Kahani, they came up with an e-clinical model that uses telemedicine. This process of using different technologies, whether it be webinars, video conferencing, you name it, to really connect these doctors to those patients remotely. So and we're going to go into how it impacts these communities and what we've seen throughout the years. Next. So we really have to go into Pakistan's history and see what the actual issue is. So Pakistan's history is facing a major health crisis where it has an issue with the doctor to patient ratio. So the World Health Organization really focuses on this issue and says that the recommended ratio is 1 to 1,000. But in Pakistan, it's 1 to 1,300. So we already have an issue with lack of medical professionals. And So this is actually really essential because it's bridging again that relationship between the doctor and the patient. And we were really investigating how this can help by connecting with the female doctors that we have a lack of to these patients in different regions. So this is really a blessing in disguise, so to speak, because while Pakistan is still developing and while we really need to look through policies and different health expectations, this is somewhat of a temporary fix. Next slide, please. So Sehat Kahani has staffed its clinics with community health workers who are really bridging that gap between the physician and the patient. So in this study, we interviewed 12 different clinical health workers as well as sent out surveys and really asked them what their experience was with telemedicine and how it affected them as a community health worker and what they felt could be improved throughout the process. Next slide, please. So after we sent out these surveys and we did we asked the community health workers how their experience was, what they would recommend. Community health workers that were not involved in telemedicine who worked with Saad Khani for less than a year were excluded. However, the majority of them did say that it did help them financially and economically, and it helped really provide better health care to different groups of people. The one issue that we did see throughout the study was the use of internet service and how it can be a problem in more rural areas. Next slide, please. So they do earn, clinical health workers or community health workers do earn a stable income by really facilitating these telemedicine consultations. And this revenue can be further expanded through health education and selling health products based on typical earnings of Raheem's, that's Raheem's. So this really did help train them to become better community health workers. And at first, there were concerns from people who were using telemedicine, especially the men whose women were the patients, because they felt that someone was making a video of their wife, for example, and they felt that there was an invasion of their privacy. But through the process of having a female physician talk to them and really explain the process, kind of put their fears at ease and really brought potential to this technology. Next slide, please. So really the main challenge we do have is the internet connection, and again, finding the right community to address these people. One, there are still a lot of taboos that do surround the use of telemedicine in the community. There's also language barriers with different with more of the minority groups in Pakistan. However, these challenges can be addressed over the years, and I see great potential throughout this project. And next slide, please. So overall, this, when asked, I think it did help many patients based on what the community health workers said in their surveys as well as their interviews. It did have technology to really give accurate diagnosis and treatment plans, as well as reduce the time needed to travel and the cost needed for the patients to see that said physician. So we saw a lot of positive feedback from physicians, community health workers, and patients alike. Next slide. And future directions, we just want to continue using AI and machine learning to really improve on this process, as well as spread awareness about its potential benefits. And also have people who are trained in, say, different languages and different cultures to also come on board on this team. And I believe that's my last slide. Oh, just my conclusion. So just the takeaways. This really did empower community health workers economically and entrepreneurially. The model offers a sustainable solution to healthcare delivery in underserved populations, and the e-clinical model can be replicated in different parts of the world. And we really hope to see this partnership in different parts of Pakistan. And I just wanted to say again, thank you so much to the American Pakistani Foundation for really giving me a chance. I felt that it allowed me to give back to my community. A lot of us American Pakistanis, while we are very grateful for what we have here, we do miss home. And in my case, even though I was born in LA, Pakistan was always the the home for me. So I'm very grateful to give back to my people. As I always say, "Hamare mulk, hamare mulk hai, hamare log, hamare log hai." So our country is our country, our people are our people. And a huge shout out to Henry, who really believed in me and really encouraged me when I was down. So thank you, everyone. Again, I really appreciate it.
Thank you so much, Mifran. I really love that last saying. Up next, we have Mohammed Abdi and Neha Farhan, who are our final Sehat Kahani Fellows for today.
Hi, everyone. It's really nice seeing you all. And I guess I'll start by introducing myself, and Mohammed can start us off. But my name is Neha. I just graduated from UCLA, and I majored in psychobiology while I was there. And I'm taking a gap year right now before going into grad school for genetic counseling and public health. And our project, or Mohammed can introduce himself.
Yeah, salam everyone. My name is Muhammad, and I'm a second-year medical student at Harvard right now. And our project is titled A Cross-Sectional Study on the Impact of the Sehat Kahani Health app on healthcare efficiency and cost among urban users. So essentially what that means is we wanted to see how is the app that Sehat Kahani has launched and is using actually impacting people who live in urban areas? Is it saving them time and any financial costs and getting them to access care a little earlier? And we were interested in that, if we can go to the next slide, because there are a lot of challenges that are like prevalent in urban cities in Pakistan. And among those are like lengthy travel times, transportation costs, just the lack of transportation in the first place a lot of the time. Getting time off work can be a hassle. And even if all of those things are kind of addressed, then there's just a shortage of local healthcare providers and long wait times at the actual healthcare facilities and hospitals. So we wanted to see, are the solutions through telehealth services that Sehat Kahani is providing, are they actually helping bridge this gap? Next slide. So essentially our like overarching theme was to analyze how much patients are saving on cost and time associated with travel to healthcare facilities and with not needing to take time off from work. So if they were able to go to their office or workplace more, then were they able to like make more money through that and like supplement their income? Was that time saved through transportation, like reducing the barrier for them accessing care earlier? So if we can go to the next slide, we kind of outline this more formally in our objectives. So we wanted to see the impact of the digital services on healthcare efficiency and expenses. And again, we just wanted to see that through the lens of travel costs and time. And then we also wanted to get some feedback on the health app. We wanted to see if patients could provide us some like feedback on what things to improve or what features they're actually using and which ones are less helpful for them. So we were able to get this information from the patients through a survey on the next slide. So we used a Google Forms survey and we had like 20 to 30 questions on there, mainly to collect demographics, the patient experience with in-person healthcare compared to the Sehat Kahani app, so we could see the differences there. And then we also asked a lot of questions about their transportation and the type of care they're accessing, like which type of specialty, when they were accessing it, for which types of health concerns. And we received almost 100 responses total from app users. And Neha can kind of go through the results that we have now.
So we have quite a few tables and graphs, but I'll just kind of go over the main ones. So first we asked about demographics on the survey. So you can see we have mostly males who filled out the survey. And then in terms of age group, we can see around 18 to 28. And then family size, we kind of wanted to see overall, like how obviously like healthcare expenses would increase with more family members. So we saw that a lot of the users of the app were paying for healthcare expenses for over 5+ people. Next slide, please. And then some more demographics, we asked about educational level. So we were looking at urban communities. So we expected a lot of people to have like, their bachelor's degrees and postgraduate degrees. And then kind of we wanted to look at the different communities where the users were coming from. So a lot of them were from Karachi, which we were expecting as well, since it's such a large urban community, but we did have spread throughout other provinces and cities as well. Next slide. And then now we're looking at the actual data. So the first half of our survey, we wanted to focus on people's experiences with in-person healthcare services, so we could compare those to their experience with the Sehat Khani app. So kind of just like we talked about in our background, the barriers that lie for people who are using in-person healthcare services. So as we expected, a lot of people who filled out the survey, they had inability to travel long distances to the facility, or they didn't have their own personal transportation and would have to utilize like cab services or the buses, and then also being unable to afford costs of visit. But I think one of the most important things we wanted to highlight was the inability to take time off work, because obviously, like, not only do you have to take time off of work for the actual visit itself, but accounting for the time to get there and the time away. So that's something that we really wanted to highlight. And then also looking at the average wait time to get an in-person appointment. So most people were able to get an appointment within 1 to 2 days, but there were some people who had to wait like up to 2 weeks or even a day. And obviously, that's not like ideal at all times. So next slide. And then just looking a little bit more about the in-person services, a lot of people did have to spend around 13 to 30 minutes traveling to a healthcare facility, but some spent over an hour. And we wanted to look at the average amount spent in Pakistani rupees spent on transportation. So there were a lot of people who spent over 2,000 rupees on just like travel costs. So if you factor that into the cost they're already spending on the in-person medical costs, it definitely adds up. And they're spending over 1,000 rupees. A lot of people are spending over 1,000 rupees on that in-person consultation. Next slide, please. And then on this one, I kind of just wanted to highlight the biggest part, which was the number of people who had to take time off of work to attend their in-person medical visits. So that was almost, yeah, 80%. And then if you look at the next graph, most people were either 1 to 3 hours, but a lot of people had to take off a half day and even a full day. And a lot of times they are not getting paid for that time that they're taking off. So you can imagine like they're taking that time off to get their healthcare needs taken care of, but they're losing out on that productivity and that income that they could be making during that time. Next slide. And then we wanted to talk about Sehat Khani's health app and the experiences. So just kind of touching on the app and how it works. People users of the app, they're basically able to sign in, and then they show you a bunch of doctors, physicians, and community health workers who are offering consultations. And a lot of times when you the nice feature of the app is like you're more than likely able to get a consultation like right away. So you just click on the doctor, schedule a consult, and a lot of times they're able to schedule a consult within like the next few minutes. So it's really effective, it's really easy to use, and you're also able to order medications on that app as well. And you can either like get them delivered to your home or have them picked up from a pharmacy that's partnered up with Sayed Kahani. So then on here, I just kind of wanted to highlight like the different services, and then what showing the different conditions and treatments that people are using the app for. And then next slide. And then people are able, like I kind of talked about, people are able to get an appointment within 1 to 2 days. And comparing this graph to kind of what I talked about before, now like around 90% of people are not having to take time off of work because they're able to get that consultation right away. They don't have to worry about traveling to the healthcare facility. So they're saving a lot of time on work, and you can kind of think of like the productivity and income that they're able to save on. And then there is like a subscription type of like payment method that the Sehat Khani app has, I believe. So a lot of people are paying a lot less now for services because of the subscription that they have. Next slide. And then we kind of just wanted to talk about like the overall experience. So most of the participants felt that their questions were answered thoroughly during teleconsultations, and most of them found consultations on the app more convenient than those in person. That's kind of what we wanted to highlight through our research presentation of like the conveniency of telemedicine and how it's helped not only marginalized communities, but also just like urban communities who are able to access these services more quickly. And then most of the people felt satisfied with the role of telemedicine in relieving the present medical problem. Next slide. I think we're almost done with all the figures. And then we wanted to talk, most of the participants felt that their experience with telehealth services was more beneficial compared to traditional in-person services, and that the Sehat Khani Health app really helped them talk to a provider quicker than they normally would. And again, like that's the role, that's like what Sayed Khani kind of set out to help do, the help patients talk to providers a lot more quickly. Next slide. And then kind of just like a quick summary of the results. We talked about the problems identified. So we're looking at the travel time, the transportation costs of the facility, long wait times at the actual facility, and how long it takes to get an appointment. And one of the biggest things is having to take time off of work, and then also not being able to have as easy communication with the provider because you're not seeing them as often. So solutions that are proposed by the Sehat Kahani Health app are there's no transportation costs or time associated with travel because it's all virtual. You can just hop on in a quick meeting, and people either had to take no time or limited time off of work. So you can imagine how that increases productivity, and also like it doesn't affect they don't have to take that time off of work. So they're kind of like getting that income back, and then also better and quicker communication with the provider. Next slide, please. And then in terms of acknowledgements, we just wanted to acknowledge Dr. Saeed, obviously, for all her help and for putting together such amazing speakers for us. We definitely both learned a lot, and Mahek and Mozambo for helping us throughout the research process, helping us with our studies design, and also providing very valuable feedback. And then Haris over at the Sayed Kahani team, he helped distribute our survey, so we're very grateful for that. And everyone else at the Sayed Kahani and American Pakistan Foundation team, especially Henry, for putting this together for us and providing such a valuable experience for us to learn so much about like the healthcare system in Pakistan.
Thank you so much to the Sehat Kahani Fellows for sharing your interesting insights and learnings about telemedicines and gaps in healthcare. I think I can speak on behalf of everyone here when I say the level of detail in your research is very, very thoroughly impressive. Now, before we move on, we're also joined by Dr. Ifat, who is the co-founder of Sehat Kahani. Dr. Ifat, would you like to share a few words about the fellowship?
Hello, everybody. First of all, I think I was listening to all the presentations, and I think everyone has done such amazing job. And because we, get caught up in our day-to-day work, but it's only when the research teams go deep and dig deeper into the work that different, segments and departments are doing, that we really understand the value and the importance and what it's giving back to the society. So I think I was listening, intently to all the presentations. And I think one thing that I can really feel is that all the fellows have done quite a lot of effort in really understanding the work on ground. And it's challenging, especially when you're, working remotely and you're not present physically. But I think hats off to all of them that they've done, a great job in really identifying all the key research points in the different divisions that different teams worked. And I think, as the co-founder of the organization, I think it always, gives me a lot of humility to, understand that, okay, this is the depth of the work that is happening in all the different segments and the kind of impact we are really able to make, alhamdulillah. So I think, again, just thanking American Pakistani Foundation always for creating this bridge and really making the younger generation see and value the different segments of work that are happening in our part of the world. So I think really a lot of effort goes into really finding, identifying, the kind of fellows who would want to come back and visit, even if it's a virtual fellowship, but understand the kind of work that's happening in Pakistan. So I think hats off to them to really identify fellows who are so passionate about the country, who are so passionate about giving back and really understanding the different causes that are happening in the country. So yeah, I think it's a great effort by the American Pakistani Foundation. And I think Henry does a great job in really collecting everyone and bringing them on one page.
Thank you so much, Dr. Ifit. And I'd also like to know that we will be taking questions at the end of all the presentations. So if you have any questions, please note them down as we're going through and feel free to ask them in the end. And now, with that being said, I would like to welcome Aksa Asghar, Polygon Education Fund board member and APF Leadership Council member, to share her remarks about the fellowship with Polygon.
Yes, hello, assalamualaikum everyone. My name is Aksa and I am a board member of Polygon Education Fund. I'll allow Samia to explain a little bit in depth of what we do, but we're so thankful for our partnership with APF and allowing us to have such a wonderful intern this session. We're extremely proud of her and the work that she's completed. And we're excited that she's extended our term with us. So we'll be having her for longer than we initially planned, but that's great because she's doing amazing work for us. Just to give a brief background of what we do as an organization. So we're a national nonprofit bipartisan organization that launched in January 2017. We focus primarily on strengthening Muslim engagement with Congress to create positive policy change, policy change and Capitol Hill. And we focus on issue areas such as civil rights, Islamophobia, racial, social, and economic justice. And we accomplish this through training, education, and advocacy. So I'll allow Samia to explain a little bit further on this and the work that she's done. So I'll turn it over to her.
Hi, assalamu alaikum guys. My name is Samia Waheed. Thank you, Aksa, for those remarks. I mean, I've been a Polygon intern for the past few months. I've been with the American Pakistan Foundation since my junior year. I'm currently a senior at Brooklyn Technical High School, and I'm just going to go into depth about what I've been doing these past couple of months and what I intend to do in the future as a APF and Polygon intern. So next slide, please. So let me just give you a brief overview of this presentation before I get started. So as an APF and Polygon intern, obviously I've been able to develop those critical professional skills, but also what I think was the most important thing for me was the ability to make an impact on so many communities. So whether it was raising awareness for voter registration or civic advocacy initiatives, we really were able to make a meaningful impact regardless of the time frame that we were given. So now I'm going to point our attention to kind of just the structure of this presentation. So first, I'm going to be talking about the work that Polygon has done over the past couple of months. And then I'm going to go on to explain its impact and its significance. And then I'll just touch on some of the skills that I've learned. And then I'll be just highlighting what the future entails. So next slide, please. So before I do anything, I'd like to thank my three mentors and the board of Polygon Education Fund for making this internship as seamless and as engaging as it was. So Nadia, pictured left, she was integral in helping me build the research skills that I needed to go over extensive archives of legislation and volumes of legislation and kind of translating it into colloquial terms that people could understand regardless of their level of experience in the policy and advocacy sphere. So making policy accessible to everyone was a key part of our mission, and Nadia was instrumental in helping me execute that. And then pictured in the center is Warda, who is the founder of Polygon Education Fund, and we just bounced ideas off of each other, and she was kind of really important in helping me kind of see what the mission was going for. And basically we just were able to advocate and organize under her. So via mail list, social media, and training. And then Aksa, who obviously you've heard from before, is also an APF member and a board member of Polygon Education Fund. So we were able to iterate like many social media posts with her. So being able to just create dynamic content that captured the attention of our supporters, she was instrumental in helping facilitate that. So next slide, please. So I'm just going to touch on a little bit of the work we've done. So from digital design to newsletters to action alerts. So in terms of digital design, we were able to utilize softwares like Canva and Adobe to create media posts that kind of featured updates from Capitol Hill, so legislation posts, and then testaments or testimonials from our community leaders and previous fellows who are making a really influential impact in terms of policy and just like community organizing, especially during the recent like political climate. So in newsletters also, we use a software called MailChimp. So within the software, we draft weekly and monthly newsletters. So our weekly newsletters entail just like a condensed version of Capitol Hill like legislation that's relevant to the Muslim community. So we're able to synthesize a lot of information and kind of turn it into bullet points or little summaries that are accessible to everyone. And then our monthly newsletters kind of just highlight kind of the work that we as an organization, a 501c3, have been doing to engage the Muslim community across the US. So under that same category, we also have action alerts, which direct our supporters to tangible, actionable like things that they're able to do in order to have their voices heard. So whether that's signing a petition, directing them to resources, or just like a host of other like things that they could do as advocates. So we direct them to it, engage their interest through the amount of clicks and just the logistics and the data that comes with having a newsletter and having like being able to track the data that flows through it. So being able to just connect with them and give them means to advocate for whatever policy, whatever legislation that they are passionate about influencing in the US is a huge part of our mission and the reason why we send all these informationals to them. So next slide, please. And then I want to touch a little bit on our impact. So within the past like 4 or 5 months, we've been able to reach mosques and community centers across the US. From Philadelphia to New Jersey, we've hosted advocacy trainings, which are like more personalized, intimate settings where people's concerns can be acknowledged regarding policy, regarding legislation, and they're just kind of given an informational session about the workings of Capitol Hill in the halls of power, so it's more accessible to everyone, regardless of their background or their level of education. So we work to amplify these on our social media and newsletter channels. And also during our time, we created a comprehensive winter recess toolkit, which is basically an action plan, which is basically like an informational section that has like action plans and talking points that our supporters are able to use during the couple of months that representatives are back in their home districts and are more receptive to the advice and the points that their constituents are making, so that they're able to like we ensure that like people are able to make their points to the representatives and get their point across, and we give them just like a starter pack into like what to do and how to do it. So in our newsletters, in socials, we're able to finally engage thousands of people through publishing unique content and amplifying material from our partner organizations, which includes My Muslim Vote, Care National, and of course, APF. So next slide, please. And then I would just want to touch briefly on some of the skills that I've learned. I'm so grateful to have like such amazing professionals working behind me and mentoring me. So I've developed skills in like communication, public speaking, and time management through working under tight deadlines and speaking at board meetings and kind of being able to synthesize my points and being able to get my point across during these meetings and during these informational sessions. So talking with my mentors and kind of developing that discourse over time, that skill set was really important to me. And then obviously all these things like marketing, project development, web development, graphic design have come along as I've worked on editing the Polygon website. So I've been familiarized with the software that comes with web development and graphic design. And I was able to explore these softwares in such an extensive depth that I wouldn't have been able to do if it wasn't for this internship. So I'm really grateful for them contributing to not only this professional skills, but also the confidence that comes with having this unique skill set. So next slide, please. So then, looking into the future, thanks to the generous sponsorship of APF, I'm pleased to announce that I will be completing a second cohort with the Polygon Education Fund. And I would just like to end off this short little presentation by saying that thank you to the Polygon Education Fund, the American Pakistani Foundation, and my fellow interns who have had just the most captivating presentations that I've heard, and for giving me the platform to speak on my internship experience. And I'm excited for what the future holds. And thank you specifically to Henry for believing in me and mentoring me throughout this entire process, and kind of giving even a high schooler the platform to be able to make important advocacy change. Thank you so much.
Thank you so much, Samya, for sharing your interesting work with the Polygon Education. We really, really appreciate all your hard work. Now that we have heard from our APF fellows and their amazing accomplishments, I would now like to invite this year's interns to share how their projects help them in skill building and professional development. I'd like to invite Iman Zahir, Ikra Wahid, Khatija Zahid, and Anaya Sheikh.
Thank you, Maha, for your introduction. Assalamu alaikum, everyone. It's been fantastic to hear all about the different fellowships we had this summer. Truly inspirational and great work to everyone. My name is Iman Zahir, and I was the project manager for American Pakistan Foundation Heritage Week. So just a little introduction. My name is Iman Zahir. I'm a sophomore at the University of Illinois Urbana-Champaign, and I am a political science major. And like I mentioned before, I was the project manager of Heritage Week. But in addition to that, I was also a GOTV, a Get Out the Vote intern, but we'll get to that near the end. I'll try to keep it brief and quick today. So here are the table of contents. One, just the organizational process of creating an entire week of events, then the events themselves, and then voting one-on-one. Great, so we'll start off with organizing the week. So for anybody that's ever put on a few events or, 7 events in a row, it takes a lot of dedication and hard work. So we started with the broad general idea of what Heritage Week was in May. So I got brought on by Henry in May, which I'm, forever grateful for. This has been a wonderful process. And in May, we started with the idea of, okay, we know Independence Day is in August. What should we do? And we started just putting some ideas down on paper. And, June quickly approached, and we started to need to understand who do we want there, what kind of events do we want to hold, and, developing some ideas. Thank you to Henry and obviously Dr. Qureshi as well for my crazy ideas that they have been able to, we were able to make into something real. And then in July, we started to plan out our details, finalize dates, titles of our webinars. Hopefully everyone on here maybe got to see a bit of that happen in action. And then in August, things quickly stepped up. We had to create media, registration links, and scripts for all of our calls. So now we'll get into the nitty-gritty of the Heritage Week events themselves. We started off with a brilliant presentation, one of which was led by our very famous Mahabat, who's here with us today, doing a fantastic job. And we had an amazing panel set up with Dr. Abdul Najam, Dr. Qureshi, Ahmad Mahmood, who's the LC chair, Dr. Saira, and Ambassador Usman Jadoon. So basically, I'll be sharing a key takeaway from every single one of the webinars or podcasts we hosted. And I think one of the main ones here was to be adaptive. We originally had some different speakers set up, but due to, political affairs happening in our world and the government, changes happen quickly. So Ambassador Usman Jadoon did a great job of stepping up for his boss. And we still had an amazing call, and that was really wonderful. So we started off the week with the 15 years of APF. And then we also had a Pakistani Pioneers in Health Tech, which was amazing. This was a great call because each of the speakers were each curious about each other as well. And so my takeaway from this one was when speakers have questions for each other, let them talk to each other. It creates more of a conversation than just say, still, here's my question for you, answer, and go on and so forth. And I loved that each of the three speakers in this context were genuinely curious about what each other were doing. And I also think it was a great way to expand, what we know about health currently happening. And some of our presentations earlier even touched on AI and health and etc. So it was a great way to combine that. Then we had the evolution of art and cinema in Pakistan. We had two very friendly and hospitable people who worked on a movie together, Hania Chima and Bilal Sami. And we originally had Hania come on, who has been affiliated with APF before. And she was like, do you mind if I bring on a friend who's worked on some projects with me? And of course we said for sure. And it made even a better conversation because they were able to bounce ideas off of each other and talk about what they had even learned together in the cinema world in Pakistan. So that was fantastic. We had a great discussion about what does cinema look like in the future of Pakistan, and why is it different than comparing cinema in India versus in the United States, and what we can see happen in the future. We also had a Pakistani American Literature Day, which was held by Professor Walker Azim and Iman Mirza. And this happened to be one of the best in terms of the comment section from an audience. We had a really fruitful discussion of people asking Professor Azim in the comments just genuine questions about literature and the way that Pakistani authors have decided to connect with their readers. Very fruitful discussion in the comments. And I think we're all very happy to see that, in a world that's heavily political and, tech is moving on, that we can get back to books and reading and learning from people who were here before us as well. And then our first podcast was with Shanaz Ramzi, who is a culinary genius. She has created a multitude of different recipes, either incorporating Pakistani cuisine into different cuisines or vice versa. And she was fantastic. And I think being able to do a podcast with her allowed for a friendlier conversation, and it was really delightful to talk to her. And if you haven't checked out that podcast, do so. Check out her website. I'm in college right now, so meal prepping is something I'm trying to, start to do, and I've taken some of her recipes, which were nice for me to follow. Yeah. And then we also had the amazing opportunity to work with media influencer Rida Ali, Sadia Malik, who is starting our next gen project at APF, also took part in this as well. Was a really cool opportunity because while APF has a outreach, Rida has even more of an outreach towards that younger generation. And I don't know, maybe some of you have seen her on TikTok. She makes amazing informational videos, and we had the opportunity to collab with her, and we are continuing to collab with her on different aspects of Pakistani heritage. She's a fantastic person to work for and work with. And she's currently also on her own academic journey as well, traveling a bit. So it was amazing to work with her. And then we also had two separate podcasts with Pakistani fashion designers. And as a young woman myself, it was really fantastic to talk to two women who were not only in touch with their culture, but business women, especially in Pakistan, and with design, an industry that is very hard to work yourself up in. These two women did a great job explaining how they got to be where they are, and it honestly came down to passion. Because of time differences, my key takeaway here was make time for your guests. We had some struggles with coordinating time zones. And again, thank you, Maha, who was able to step in for me, so I didn't have to film something at 3 o'clock in the morning. But truly great conversations. If you're looking to learn about passion from women and especially women business owners, 2 very great podcasts to check out. And then we also had a blog post by Mawish Nasir, who is a member of the APF Leadership Council and also the West Network Ambassador. She did a wonderful job explaining how she took part in Pakistan Day, and just a great blog post. Check that out. Truly heartwarming. And she was able to encourage in-person participation with an organization like ours, heavily held online. She managed to bring the APF side of being online and in-person events and merge them together, which was really wonderful. Okay, awesome. Now we'll move to my GOTV moment. Ikra's here with me, so if she wants to touch on that, take it away.
Hello, everyone. I want to thank you all for being here today. I don't want to take up too much time, so I'm going to try to keep this short, but I'm very honored to speak about my time as an intern for the American Pakistan Foundation's Get Out the Vote program, and especially during this time where the 2024 US presidential elections, they creep closer. This entire experience was very transformative for me, and I know my sister Samia, who just spoke earlier, she can say the same when I say that we learned a lot about civic engagement and then also understanding the power a community can have in like a population's mobilization. So as a GOTV intern, my primary goal was to join meetings weekly where we discussed on how we could help mobilize the Pakistani American community into being persuaded to vote. And it was a unique challenge and it was an incredible opportunity. I know I myself was a bit skeptical at first when I started because like first thing that comes to mind was how many of our parents may have and grandparents may have became citizens in America, but none of them have ever voted because we hear about them saying, oh, our vote doesn't count, or I don't like any of the candidates, right? And it was just a unique challenge because there are many barriers to political participation. And what we have to acknowledge at the end of the day is that us being able to be involved in politics is a right in of itself. So just being able to vote is something that's a blessing, if anything. And so therefore, when we are faced with challenges such as lack of awareness, unfamiliarity with the voting process, or just the belief that a vote doesn't matter, one of the most rewarding aspects of this internship was being able to change that narrative and teach others and empower individuals on how to make their voices heard. A major part of my role was being involved directly with the voters. So many of these people were people that had never voted before. So this includes like freshmen such as, well, at the time when we started the internship, Iman and I were both freshmen. So this includes people that may have just turned 18, 19. They may have registered to vote in the past when they were 16, but now like as the US presidential elections creep closer, we all were discussing on, oh, do we want to vote in this election? Like, can we vote? How can we vote? How does the entire process go? So we reached out to voting age Pakistani Americans and we helped them pledge to vote and we guided them through the voter registration process. And one of the most fun things I did with Iman was record a YouTube video on voting 101 and teaching others on like the steps on what to do when you get to the polls and what to do come voting day. And a lot of the times, like what I had to do was connect with other PSAs. And this was also a very like fun experience for me because I was able to connect with other CUNY students. So I go to CUNY John Jay, which is City University of New York, and we also have a lot of other branches of colleges. So I was able to connect with the PSA at Hunter College, the PSA at Baruch, and it was fun for me because I was able to not only network with these other Pakistani student organizations, but we were also able to teach them about how we can enable other Pakistani Americans and be able to answer questions, clear up doubts, and give people the confidence that their participation in the election was essential. So we also were able to reach out to some older South Asians that may have been like American citizens, but they have never voted before. So this is way different than the audience of like 18, 19-year-olds. Now we're looking at adults who may have just never voted in the past, right? And just election day didn't really mean much to them. And we were able to create and circulate educational resources to raise awareness for Pakistani Americans. And this part was very fun because we were able to see how these materials, whether it be on Instagram, LinkedIn, and they were able to bring people together and ignite conversations. And I recall in the webinars, we had many people come on and speak about their concerns, and then we were able to give them advice without swaying towards any specific political party and being able to maintain APF's 501c3 status, which in my opinion, I think is an art form on its own because it's very difficult. But one of the most important parts of this internship were the webinars and how we were able to bring people from different community sectors. I'm very grateful to be a part of a team that was able to bring together community members, students, business leaders, public officials, and they were all able to amplify stories on civic engagement and discuss the lessons that they learned and strategize ways to ensure that Pakistanis care about the political process. And I was just kind of, I had a reignited sense of civic duty, which was intertwined with cultural identity. And just to close off, I want to say my time as a GeoTV intern really reinforced the ideas that democracy thrives only when people participate. There's no democracy if people think that it doesn't matter or it's not real. Moving forward from this experience, I really hope that I can help further other members of the community to learn more about how we can help the next generation of Pakistanis in America. And I also look forward to being a part of the APF community, not only like within my time in college, but beyond when I start my professional career, whether this be through the Leadership Council or other programs that they host. And I thank you all for your time.
And then just to wrap up, completely echoing everything Ikra said, a thank you to Dr. Nasser Qureshi, Henry, Sadia, who I don't think was able to join today, and also Mustafa, who helped me endlessly on the Heritage Week projects. And obviously a humongous thank you to APF in general for allowing us undergrads to be successful and really create our own internship in of itself, you know, being able to lead a pathway of what we genuinely want to do and allowing us to do so. So thank you.
Thank you so much, everyone, for your wonderful presentations. And now up next, we have the APF internship presentation by Anaya Sheikh and Khadija Zahid, who are also our GoTV research interns.
Thank you, Maha. Hello, everybody. My name is Khadija Zahid, and before I do anything else, I would like to thank Henry Alfine and Misal Irfan, who I don't think she's here today, but I thank you for the mentorship and support and for just being the absolute best. I don't think this internship would have been the same without the both of you, so I appreciate you guys very much. So during my time, next slide, please. Thank you. So during my time as a research and GoTV intern at APF, I had the privilege of wearing multiple hats, one of them being Deputy Vice Chair, as Henry once called it, of all things webinars. In this role, you know, I was able to, I was responsible for coordination to the final execution of each webinar from the back end. So this meant that I was heavily involved in setting the theme and overseeing logistics, whether it was moderating technical issues or event organization. I also ensured that everything I just ensured that everything operated accordingly. This experience allowed me to really fine-tune my organization skills while also learning how to navigate unforeseen challenges quickly. In addition to spearheading webinars, I was also responsible for curating the outreach database. This included identifying potential donors, cleaning the database, collecting relevant data, and also segmenting audiences for targeted communication. I'm going to turn this over to Anaya. Next slide, please. Thank you.
Hi everyone, my name's Anaya. I'm a senior at the University of North Carolina, and I'm also a GeoTV and research intern. Just like Khadija, I kind of floated around multiple sectors of APF. I actually entered the GeoTV group a little late in the summer, around June, July. But my first task was part of operations, doing grant research using the instrumental database. Now I've never done grant research before, so this was definitely an experience for me that I'll take wherever I go. There were definitely some challenges along the way. I think just trying to figure out the goals of certain companies and their grants, and then APF's goals, and trying to intertwine them together to find the best matches possible. And so I'm currently doing that as well. I've been doing that throughout. And then the second action that I did was a little bit part of communications. I took a graphic that was on the on one of the APF informational pamphlets that had a lot of wonderful actions that APF had done before, and I kind of just put it up in Canvas and just organized it in this layout. So I have that on the left, but on the next slide, I guess Khadija and I will talk about our work that we did together.
So one of the highlights of my internship was hosting a webinar focused on advocacy in the Pakistani community within the US. So I directed every aspect of this event, from coordinating logistics, schedules, to crafting the agenda and developing key questions for the panelists. Additionally, I designed an infographic that was then shared on social media. The webinar was a success. It resulted in a diverse group of people. And it really, showed me how advocacy efforts can be streamlined through very thoughtful event planning. We also saw several impactful outcomes. So first, there was this sense of collaborative learning. The panelists were able to share their understanding and insights on the topic, and that fostered an environment of mutual growth. We also shared very actionable strategies for advocacy during a very challenging time, like the one we are in right now. We facilitated resource sharing opportunities, including our Pledge to Vote tool, which, by the way, if anyone has not signed it, it's on the APF's website, so definitely consider. Just in summary, it was a very enriching experience for the panelists, the audience, as well as myself.
Yeah, so this was my first time. I was the moderator for the webinar, and it was my first time moderating. So I definitely learned a lot about just the process of from the beginning to the end. Khadija helped a lot with coordinating with the participants, but I guess behind the scenes, creating a webinar memo with a script, having their bios, introducing them, and just moderating Zoom. I think part of operations, it's really important. And so I think I finally realized that. So props to Maha for taking this on. But yeah, just ensuring that everything goes smoothly, handling, Q&A, chat, everything. And then finally, I think the takeaway is advocating for Pakistani American civic engagement. This was basically part of our entire internship, and our research as well is very heavily based on that. And all of our panelists were people who had participated in public service from Polygon and from the State Department. So yeah, actually our next slide is about our research experience with Pakistani American civic engagement. So I'll just go ahead and start off with the process started off with producing an annotated bibliography with just a bunch of articles, a bunch of research documents, and concising them into paragraphs to guide our literature review. So we compiled a culmination of sources to provide the history and current challenges with Pakistani Americans and civic engagement. And then the literature review provides the necessary background information for the rest of our paper that we're currently producing, and hopefully will have it done very soon. And so that's mostly what me and Khadija focused
on. Oh, sorry, can you go to the previous slide? So regarding the last 2 points, one of the very important initiatives that we worked on for our research report was the Pledge to Vote campaign. The idea was to create a sense of civic duty, whether on just the local and state elections, and also kind of raise awareness about the significance of civic participation as a means to influence policy and representation. We are also conducting interviews as part of the methodology. These interviews are imperative for gathering qualitative data to supplement the findings from other sources. This includes data from community leaders to advocates from all age groups to really understand their perspectives on civic advocacy, the challenges within this space, and what motivates them to engage or disengage from all of this. As Anaya mentioned, we will be sharing our research report very soon, so please keep an eye out. And thank you again for the past 6 months. This internship does not mean the end of my presence in this community, so I look forward to the future. Thank you.
Thank you so much, Khadija and Anaya, and thank you to all of the fellows and interns for your wonderful presentations and all the hard work that you put into your projects. Our partner organizations have done such an amazing job at providing the fellows with a platform and the resources that you share, but it is you, the fellows and interns, who thoroughly impress us with your learnings each year. So kudos to everyone and congratulations on completing your successful projects. I'd like to end this session by again thanking the fellows, interns, and partners for yet another successful year of APF programs. It's all possible through your hard work and dedication. And I'd also like to highlight that APF has its new Pakistani American Knowledge Network on YouTube, which hosts all our recorded webinars through Heritage Week and every one that has been recorded each time we have had hosted a webinar, and also our podcast. So please check that out for our upcoming webinars and keep the learning with APF going, as Khadija said, being a part of this community, even as your fellowships end. So thank you, everyone, and best of luck for your future endeavors.